Colin Hung with Healthcare IT Today, where we explore the latest trends in healthcare technology. You know, everyone wants to leverage their health data, but getting that data to a level of quality where it's actually useful takes a lot of investment. But getting that investment and sustaining it is pretty challenging. That's why I'm excited, and we're so privileged to have Dr. Jim Jirjis, Chief Health Information Officer from HCA, here with us to talk about this challenge. Dr. Jirjis, welcome to the program.
Well, thank you very much for inviting me.
Now, before we dive into some of your successes with the health data initiatives that you're doing at HCA, can you give us a little bit of insight as to why the quality of data is so important these days?
Yeah, I can. First, what I like to say is, when I arrived at HCA, there's a lot of excitement because we're so big, 185 hospitals, thousands of clinics, and we end up with all this data from all these hospitals and clinics dumped into a data warehouse, and everyone in the company, I might say, had magical thinking about just how ready we were to use that data.
Right. Okay.
There's a lot of excitement about the size of our data, how we can get insights that others can't, which is true. And our data was so big, for example, at the time, this is about 7 or 8 years ago, 30 petabytes of data. You know how big that is?
No, 30 petabytes. I mean, it's just a
number. It's hard to get your head around, isn't it? So I found an analogy. Post-it notes, how thin they are. Well, if you take 1 byte of HCA data and you put it on a Post-it note, on a bunch of Post-it notes, and you stack that up, how tall do you think that would be?
I'm going to guess to the moon and back.
Good guess. A little bit off.
Okay.
Want to go high-low? Yeah. Turns out it's 30 one-way trips to the sun, and that was 8 years ago. That's a lot of data.
That is
to the sun.
That's a lot of Post-its.
Which led one of our leaders to say, isn't that the same thing as 15 round trips to the sun? And I said, well, I got news for you. If you're going to the sun, you ain't coming back. So it's 30 one-way trips, right? So it turns out that there's a lot of excitement about using it to get insights to improve the quality of care, reduce costs, et cetera. A lot of exuberance and enthusiasm. And one of our leaders said to me, I want to do 20 data science projects this year.
Wow.
And I said, I live in fear of my phone ringing, it's you on the other end, and you're asking for one more.
Let alone 20.
This look of shock. So what do you mean? So let me explain, we have 185 hospitals. Let's look at sepsis, an infection, usually caused by an infection, not always, but if you catch it early, you can save lives. If you don't catch it early, there's a 50% death rate. So we're looking at catching it early. And there's about a handful of data elements that go into an algorithm to detect it earlier than a clinical doctor would or nurse. And let's just look at one of those data elements, a lab test called lactic acid. The higher it is, the more likely it contributes to a set of data saying, hey, this person may have sepsis. Because we want to respond when we smell smoke, not when there's flames. We want to catch it early.
Right.
I said, just that one data element. 185 hospitals have 708 different terms for it.
Oh, man.
Those 708 different terms dump into a data warehouse that is like the Tower of Babel. You've got to have the Rosetta Stone. You've got to be able to map all of that to the 11 LOINC codes, the 11 standard terms, so that then you can incorporate that into an analysis. And I said, when you ask for one more data project, it takes us 9 months to sort through the 14 data elements, the 700 ways each one of them is termed, to map them all, to do the 27 minutes of analytics you're thinking about.
To rebuild essentially the Rosetta Stone every time.
Correct. And so what I like to say is, and I read this somewhere, and I think it's really true, and that is that if your job is data quality, your biggest challenge is going to be to educate your sponsors that it's an important enough thing to put real money into an investment in the data itself to prepare it for use. Because there's a lot of magical thinking. Now, for some purposes, things like ChatGPT-3, et cetera, may obfuscate our need in certain situations, but not in all situations. And I think it's really important to invest in the data itself, because then it can leap huge dividends.
And was that the light bulb moment for your executives when you were able to explain to them that, hey, like before you could do these 20 data science projects, you needed to clean the data, make it better quality? Did they realize that, now I should put health data quality at...
It was more of a dimmer kind of glowing, because I think, it's something that's a really opaque topic, and people don't understand it. And when you're asking for money to actually, prepare the data for use, it takes a little bit of time. But it's time well spent, because the return on that investment is enormous, because it's felt in multiple areas. You'll start doing data mapping and data quality for one purpose, and then suddenly you'll find 10 other reasons to use what you just built, right? And the other thing I'd like to say is, that I want to point out that when you say data quality, people, again, they think you're saying something different. They think that the potassium value in the lab is not right. It's poor data quality. That's not what we mean. What data quality often encompasses is, have we mapped the data so we understand what a lactic acid is? That's really more what we're talking about. Yes, there's issues on, is the data quality, is someone typing in all zeros for a social security number? That's a data quality problem. The fact that everyone has a different term for a social security number is also a data problem. And it's more complex than people think.
I want to go back to something you said, two things actually. You mentioned your sepsis program,
right?
And you just talked about how you got some unexpected uses for data when you invest in data quality. You had a very unexpected result from your sepsis program. Can you tell me about that?
Yeah, well, I think the best example that I would say on the heels of sepsis is we decided that nurses, you'd have to live in a cave these days to not realize the nursing workforce shortage, right?
Sure.
But even before that, we realized that nursing documentation was taking an enormous amount of time.
Okay.
We wanted our nurses to take care of patients, not paper. And so we underwent a big campaign to streamline nursing documentation to just what was needed for the patient care and outcomes and goals, eliminating 20% of unnecessary documentation. But we also used a clinical terminology standard called the CCC, which is an international terminology standard for how you capture what nurses document so it's machine understandable. And we built our system around it. Meanwhile, with clinical architecture, we started also working on mapping data outside of that realm, right? That's already unmapped in our warehouse. Here, what we're removing is in the workflow as nurses document. They're documenting in a way that captures that standard terminology on the front end.
Okay.
It's too hard with 185 hospitals to do all the labs and everything else on the front end. So what we do is we dump those into a warehouse and we then apply the data mapping called normalization, right? What we learned is we were able to reduce the amount of documentation burden on the nurses, and we were able to create data that we could use to get insights into care. We did all that just to help the nurses have better, more streamlined, efficient documentation. But we found out that there was another purpose we'd use it for later we didn't even intend.
Tell me about that.
Well, we have 185 hospitals. About 40% of those hospitals are in a hurricane zone. Okay. Florida, Texas coast, New Orleans at the time. And a hurricane is funny because it's fickle. You don't know what it's going to do.
Right.
So hurricanes tend to go up Florida. And we have, let's say, 50 or so hospitals, 40 to 50 hospitals in Florida. We have to be ready to evacuate those hospitals.
Right.
So imagine in the middle of a hurricane coming, nurses with clipboards had to run around. This patient needs a ventilator, breathing machine. This person can walk out on crutches. This one's going to need a special helicopter on a heart pump, right? All different needs for transportation, and they change by the hour.
Sure.
So in the middle of a hurricane, you had high-value nurse leaders running around with clipboards, capturing all this stuff. Well, because you never know where the hurricane's going to go, on a dime you need to be able to evacuate.
Right.
Well, once we did all this data mapping, the next time we had a hurricane come through, they started to deploy those nurses again, and our team said, hold on, give us a few hours. What? Because all the data was ready and had been mapped for another purpose, we were able to come back with, at first, an Excel spreadsheet with every hospital, with who was on a ventilator, who was on an IV drip, all the different needs, transport, all automatically happened without any human effort. Freeing up those nurses from scurrying around with clipboards,
right,
but instead being able to actually do a higher value task, right? All automatic, all current and up to date because of data mapping.
Because you'd invested
powerful.
all of that, right?
Those nurses could be used for something more high value.
So that's a very clear example how data you cleaned up data for one purpose, and it was fruitful and very useful for a totally different one that you anticipated.
Yeah, and then on the heels of that, so we keep using it for hurricanes, then on the heels of that, you'd have to again live in a cave to not know that COVID-19 hit.
Right.
Well, guess what? Our data was already mapped, our visualizations were mapped, and for much smaller effort, we were able to actually get the insights and the views, so our CEO could make excellent decisions about deploying ventilators. How many ventilators? which ICUs across our 185 hospitals, right?
Right.
Which hospitals were almost full of ventilators and which ones weren't using them, and can we move them?
Can we move them
right?
around? Can you shift them
so
around?
he
Sure.
was able to make intelligent decisions about staffing, about materials, about supplies, etc., on a dime because he had the intel. So the cool part is, if you're making the case to investing in mapping the data itself,
Right.
you just need one or two business cases to show the return. But the dividends, it mushrooms after that. And that's why I say investing in the usability of your data is probably one of the highest leverage investments with return you can make.
Talk to me a little bit about that. How would one start down this path? Like, what would you recommend to someone who's watching or listening to this, who wants to get better quality data, but just isn't able to get it off the ground? What would you tell them? What advice would you give them?
Well, as I think Thomas Edison said, he isn't famous for being the one who invented the light bulb, right? He's famous for discovering the 1,000 ways not to do it that don't work, right? So we have a little bit of that. As we started out, we started manually mapping the data. So we said, okay, let's look at a tool. So we found a tool that let us get the data in from all of the different hospitals,
right,
and have a human map them and do versioning, et cetera. And we're able to do that, but that only really helped you because it's expensive.
Right.
Using people, it's not sustainable, and you can only really apply that when you have specific problems where you know what the data is. Once you start getting to a hurricane hitting or some other purpose, you'd have to ramp up.
You have to ramp up that,
70 people
sure,
to map the data to use it. It's too late.
Yeah.
So one of the things we learned is that we needed to partner with a good partner that has experience with mapping the entire laboratory domain. There's 10,000 lab codes, right? How do you map the mnemonics of the local hospital uses in their EMR, for example, or lab system, where it's not mapped to a standard? How can you automate that? And that's where companies out there like Clinical Architecture and others are able to actually automate 90% of it, so that you're not just doing mapping just in time,
Like a one-time map.
but you're doing it just in case.
Right.
So now we have all of our lab domains, we have our medication domains, we have our beds, we have all these things mapped, our nursing documentation. So increasingly, as more and more is mapped, it doesn't matter what problem is thrown our way, the data's already ready to be used. And that's the secret. How you get the flywheel going with your sponsors and your leaders so that they understand, you simplify why you need to invest in the data itself is the biggest trick. But if you can accomplish that, the internal rate of return for your company is enormous.
And what's it been like working with Clinical Architecture? It sounds like you're leveraging them quite a bit for your mapping and for other internal.
Well, one of the things we liked about Clinical Architecture is I think 80% of their employees are engineers.
Okay.
Right? And so they've been doing this for a long time in the clinical domain, so they out of the box are able to help map entire domains very efficiently and effectively using automation in most cases.
I got to ask you this. I can't let you leave without asking this question. Before we got on camera, you said something where you said data quality is not a technology. In fact, data quality is a lifestyle.
Yeah.
What do you mean by that?
Well, data quality is something that needs to be continually fed and watered, right? And new data comes in. With COVID, for example, what happened with COVID? Suddenly there's this new lab test. And everyone was calling it something different. And it was dumping into our data warehouse. And so it's an ongoing process because there's always new data that has to occur. Technology can support it, but there's also process. And one of the last things I'll say is it's never been more important to be concerned about this, because we've been talking about our own internal data and its uses, which is enormous.
Right.
But with 21st Century Cures Act and with interoperability and all this data we're all becoming aware of is being transferred now automatically, the data is following the patient wherever they go. So not only do you have your data, but when you see a patient, automatically data from elsewhere is now in your warehouse. If you can map that too, then that can give you a purview of a fuller picture of what's happened to the patient. What happened to here's an example I give, a popular example I give is there's a condition called sleep apnea.
Okay.
Many of you are familiar with sleep
apnea. Sleep apnea, of course, yeah.
Where you can't breathe, you get low oxygen. It can contribute to heart failure, high blood pressure, etc. Well, it's often not diagnosed.
Right.
But with some of these new tools like ChatGPT and other AI tools, imagine all this data coming in from wherever the patient's been, not just my hospital. Maybe my hospital, we caught that the patient was overweight. Maybe in a clinic that we don't own, they captured the patient was depressed. Somewhere else, the patient mentioned snoring. And somewhere else, the patient's wife mentioned he's always sleeping, right? All those things are clues that the patient might have sleep apnea. Imagine all that data coming in, and you as a health system are identifying that this patient may have sleep apnea. Let's test them, get them treated for it. We'll improve their outcome by detecting it sooner, and it's a service that we deliver. It's wonderful. So there's never been a better time than now with the liquidity of data to be concerned about whether you're ready in 2023 to do something with the data. Because the winners are going to be those who can.
I love it. Dr. Jirjis, you've shared so much great information with us today. Thank you so much for being on the program.
My pleasure. Thank you for having me.
This has been Colin Hung with Healthcare IT Today. And if you enjoyed this interview as much as I enjoyed being part of it, give us a like or subscribe to us on YouTube, Spotify, or wherever you're listening and watching this. Plus, head on over to healthcareittoday.com for the latest news and insights.